Good afternoon, everybody. I am Dr. Ashok. I am an ENT consultant at Sakra Hospital. So, today we'll be talking about something which is related to COVID, about preventive ENT care during COVID-19 pandemic. So, we have got some questions. So, I would start by asking the first question I'll be answering now. The question is, what are smell and taste disorders? Is a patient suspected to have COVID-19 if they experience such disorders? So, smell and taste, mainly they are organs which are located in the nasal cavity, mainly for the smell. And this nervous tissue is present deep inside the nose, at the upper part of the nose, where it separates from the brain. So these nerve cells have to be stimulated for us to smell. So if there's a decrease in smell, it is called hyposmia, or complete loss is called anosmia. And taste is directly related to smell. So if we can't smell properly, we see that a taste also is not adequate. So there's a separate sense organs which are present onto the tongue. They're taste buds which will identify the taste, and along the nerves the impulses are carried to the brain, and that's how we perceive the taste. So on the tongue, if you see, there are different taste buds. In the front we have the sweet taste, at the back that's a bitter taste, along the edges of the tongue it's the salt, and the sour is on the sides. And the new taste which has been added recently, it's an umami taste, which gives that feeling of that delicacy or the liking for certain food. So that is the fifth sense, fifth taste sense. So what happens is, when these nerve cells get affected by any infection or any other illness, we might not smell properly or taste properly. So this disorder can be due to lot of causes. We have seen that when you have common cold, our nose is stuffy and we may not smell food and we don't like food. So similarly, other conditions of the nasal cavity, when there are polyps, any growth, any infections, we may not smell properly and taste properly. COVID infections are found to cause loss of sense and taste. That is mainly because these COVID viruses, they affect the nerve cells or the supporting cells which are adjacent to the nerves which are present deep inside the upper part of the nose. So a typical characteristic which is found is these type of sensory loss, or the nasal or the loss of sense of smell, is temporary when you find it in COVID patients. But this is highly predictive of COVID. A patient may not have fever or cough, but suddenly might feel that his sense of taste or smell is lost. We should highly suspect the patient has COVID and should be tested for it. But luckily, this is a temporary finding. So it's good that when the patient recovers from this COVID infection, his sense, smell and the taste sensitivity comes back. Other conditions which can cause this loss of taste and smell is in elderly, when there are neurological problems, brain tumors with certain medications. But when we find that it's a sudden loss, we have to be cautious that the patient has COVID. Now, I'll go to the second question which has come up. That is, whether we can treat these conditions. When you have loss of smell and taste, what is the treatment which is provided? So in a COVID patient, we may not give anything specific for the taste or smell. Only thing, if the patient doesn't have any other symptoms, if it's just loss of sense of smell and taste, we have to build up his immunity by giving multivitamins, B complex, or zinc is considered to be good to build up the immunity and to prevent further deterioration. So zinc tablets or vitamin C Vitamin C, you can take supplements or take fresh fruits, plenty of fresh fruits and vegetables. Vitamin D supplementation, this should help in rapid recovery. Unless the patient has some other symptoms like fever, cough, and loose motions, diarrhea, these symptoms has to be treated. But if he's otherwise asymptomatic except for loss of smell, you need not worry. You take care of your immunity, eat plenty of fresh fruits and vegetables, have good night's sleep, rest properly. I think the person should recover. So there's no definite treatment as such for loss of smell. I would like to go to the third question which has been asked. Are patients with ENT disorders more prone to get infected by COVID-19? Now, when you see an ENT person or patient with ENT disorders, nobody is different from any other thing. If it has ENT symptoms or doesn't have, it doesn't change the probability of a person getting COVID-19. It's only that if a person has low immunity, the person will be more prone to pick up a viral infection. So our priority should be to remain healthy. Remain healthy means adapt healthy habits, be it food, then proper sleep habits so that you get adequate rest, reduce the stress levels, drink plenty of water, about 8 to 10 glasses of water per day, supplement enough vitamin C, exercise properly so that you get good exposure to sunlight, about half an hour of sunlight daily so that you get your dose of vitamin D. So as such, there's no difference that if you have ENT symptoms, you might pick up infections. That's not the case. Let's go to the fourth question which is asked. What preventive measures can be taken by ENT patients to avoid COVID-19 infection? Now, as I was telling about building up the immunity, but there are certain specific measures which we can take. We should understand how we get the infection. Mainly, COVID-19 is a viral infection. So this virus usually affects us through the respiratory tract. So when you see that somebody has an infection and the person is talking, coughing, sneezing, there are droplets of this virus along with the saliva which are dispersed into the air around us. And these droplets are the infective part. So that when somebody inhales, it goes into our body. And also, it's not just inhaling. The rest of the droplets will fall onto the floor, onto the desktop, on our laptops or phone or anything, whatever we are holding, or anything around us. And when a person touches that, your hands will be contaminated. And then with that, we might touch our face, our nose, mouth, anything which can be transmitted. So the care what we have to take is to prevent inhaling that, first of all. So a mask is a must. So the mask should be worn in such a way that our nose is covered and our mouth is covered. And it should be tightly fitting so that there's no leakage of air around. Or if it's loosely fitting, we might be inhaling the air which is not filtered through the mask. So mask is the best way of preventing COVID infection. And also we have to see that we maintain distance. Social distancing is a must, and avoid crowded areas, and also going to areas where like shopping and other places where a lot of people are around. So even when you wear a mask and we'll be touching things. So hand washing is must with soap and water so that we wash away all the excess virus which is there on our hand and also wherever we are touched. So the best way of preventing is with a mask, because it's a droplet infection that we are picking up. And when should I see an ENT specialist? So usually it's not an ENT infection as such. When you see, the route of entry is through the nose and the mouth. So the person coming or getting infected can have these symptoms to start with. Might have nasal congestion and irritation, or irritation in the throat, might have dry cough. So some patients might have ENT symptoms, some may not. They can directly go in for breathlessness, and some might collapse, they'll have high grade fever, chills, some might have loose motions, stomach aches. So they are varied type of presentation of COVID. But because the route of entry is in the throat and through the nose, so we might have ENT symptoms. But it's not that everybody having sore throat has COVID. So when you have such symptoms like nasal irritation or sneezing, majority of us have allergies in Bangalore. So there's no need to panic as such, but what we can do is just relax, take your anti-allergics, do some nasal washes, and see that whether you're settling down or not. If you develop other symptoms, we have to rule out, and then you'll have to meet an ENT surgeon to see that whether you have COVID infection. But only way to see is just a sore throat or an irritation in the throat. You need not panic and meet a doctor. If there are elders at home and if you feel that you might be transmitting the infection, it's better to isolate yourself for a day or two. And if you're recovering, you need not worry about it. So mild throat irritation or mild fever, you need not worry. If you have severe body aches, or if you feel tired, becoming breathless, there are all the chances that you can have COVID, and you have to get yourself tested. So I'll go to the next question. So what are the symptoms that I may have ENT disorder, and how do I take care of it? I think this is a general question. So ENT disorders as such, there's a wide range of ENT disorder. COVID related, I told you. If you see anything above a collarbone is related to ENT, except for the brain and spinal cord and the eye, which is taken care by the eye doctor. So there is a medical field and a surgical field to ENT. Medical field is mainly all the sinus related or nasal allergies, tonsillitis, throat pain, ear discharge. This can be treated medically. But there's an other aspect of it which needs further evaluation. Like when you think about any thyroid swellings or salivary gland swellings which are present. Some may have cancers of the nose, for the ear, the vocal cords, and the food pipe. That need to be treated in a totally different way. So the symptoms are varied. It can be related to the nose, like I initially mentioned. Sometimes there can be voice change, difficulty in swallowing, neck swelling, headaches. All these are related to ENT. So depending upon the symptoms, we need to take care. But like a general ENT care, what we can do is, we should not use cotton buds to clean the ear, because wax is something which easily forms. But ear has a natural tendency to cleanse itself. When you're taking bath, water goes inside the ear and will cleanse itself. So we should not use cotton buds on a regular basis. We should not try to clean it whenever you feel itchy. It will get cleansed on its own, and whatever is coming outside, you can wipe with a wet towel and that clears the wax. Similarly, nasal cleaning, or like using some cotton and cleaning it, that should be avoided. Picking of the nose should be avoided. If there's itching sensation, you can lubricate with some Vaseline or oil, that should help. Breathing exercises helps. So generally this should be avoided. Using of headphones to listen to music or earphones on a regular basis is not good, because that can lead to hearing loss, and which can be a permanent thing. So these are the normal or routine things which you can take care to prevent illnesses or things which can affect your ear and nose. Regular gargles is good, so that will cleanse your mouth and your throat from the bacteria and the dust which goes in. So these are the usual measures which you can take. I'll go to the next question. What are the most common ENT problems that are dangerous? Now, like I was telling about the wax which is forming in the ear. If we regularly use cotton buds to clean the ear, there will be minor scratches which are forming in the ear canal. And these scratches in a diabetic or in a person who's ill, like a person has kidney problems or it's a cancer patient with chemotherapy, these small scratches will allow the bacteria to enter the deeper parts of the ear. So the bone gets infected, and from a minor wax, it ends up as a serious infection. And because the ear is adjacent to the brain, these infections can spread to the brain and lead to a condition known as malignant otitis externa. This condition is so serious that we have to give IV antibiotics for 6 weeks or 8 weeks or more, but still most of the people end up losing their lives. So ear infections can be dangerous because of the proximity to the brain, to the eye and other vital structures. Because the main sense organs are in the head and neck region, and also the major blood vessels and nerves which pass to the brain, it passes through the neck. So infections in these areas can be dangerous. Like a dental infection, if not taken care of, it can lead to pus in the neck. And that is a dangerous condition. Sometimes a sharp tooth in the mouth can lead to constant irritation of the tongue, and which can lead to cancer. So these are some things which we usually neglect, but it can lead to dangerous conditions which can be life-threatening. So small things like caries, dental caries or sharp tooth should not be neglected. It has to be treated properly, adequately, so that the filing of the teeth is done. It doesn't cause trauma to the tongue and lead to cancer. So I'll go to the next question. Does an ENT problem need surgery, or does it get better with time? So, like I was telling, there's a surgical aspect to ENT and a medical aspect. So, infections can be treated medically, but certain conditions like the tumors of the thyroid or tumors anywhere in the nose, on the throat, ears will have to be treated surgically. Cancers need different type of treatment. It can be treated surgically or by other means like radiotherapy. So usually tumors need surgery. There are also certain conditions where it can be benign, like it's not a tumor which is cancerous, but benign conditions like there will be change in voice, there can be an additional growth in the vocal cords which might have to be treated surgically. So these are microsurgical techniques which we use, or endoscopic techniques which we use to remove these tumors. So there's a wide range of surgical procedures which are done in ENT. Ear surgeries are usually microscopic surgeries because it's a delicate area where the balance organ and the hearing organ are together. So to access that area, we do microscopic surgery. And also surgery is done for ear reconstruction, where we reconstruct the eardrum and also the ossicles which help in hearing. Nasal surgeries are usually endoscopic surgeries where you use an endoscope and a monitor so that we can see the details of the nose and the paranasal sinus through the endoscope. And because the proximity of the eye and the brain, this helps in delineating the structures properly so that we don't inadvertently damage these structures when doing the surgery to the skull base. Other surgeries of the larynx or the voice box which is telling or the food pipe can be done with endoscopes. So that these are different types of surgeries which we do in ENT. So coming to the next question which has been asked, how can I tell if I have an allergy or a cold? Is medication the right option for me? Usually nasal problems like nasal allergies, common cold, any nasal symptom, usually it's irritation of the nose, sneezing, running nose or blockage. But what happens is if a person has allergy means hypersensitivity. Like when you have some irritant, like when you're inhaling dust or smoke or pollen or something which your body is repelling. When you're inhaling that, there'll be irritation in the nose, we start sneezing, and then we get running nose. So this can vary among people. It can be a mild allergy or it can be a very strong allergy. If it's a mild allergy, the only thing what will help is you can just wash your face and nose and you'll be relieved of the allergy. Sometimes it can be severe that you have to take anti-allergic medicines or nasal sprays to control the allergy. And vice versa, if we see what is common cold is a viral infection. And there are various groups of viruses which can cause this common cold symptoms. So the symptoms are almost the same. You have runny nose and irritation, nasal blockage, but you might have headache, you might have mild fever and aches. But because it's a viral infection, it will take a couple of days for you to settle down. Usually our immunity is able to handle this infection. It is taken care of. You don't have to take medicines to control it. But if you feel the fever is high and the symptoms of body ache and other symptoms of more malaise is there, you might need paracetamol or any painkiller to reduce your symptoms. If the fever is high, you might need, or just rest will help, and by the end of third day or fourth day, you might recover. So the basic thing is rest, hydration, and adequate rest, sleep, which is going to recover you from the illness. So the symptoms wise, there is a mild variation, but the causation is totally different, treatment is totally different. Allergies are rampant, so usually there will be a source which is triggering the allergy. So if you know that every time you get exposed to dust, you have sneezing and running nose, then it is clearly allergy. So you avoid the allergen, your symptoms will be better. So better to avoid getting exposed to dust when there's somebody dusting or you go on a dusty road. Wear a mask or cover yourself, you'll be better. So avoidance is the treatment for allergy. But if it is severe, you might need medication. So I'll come to the next question. What would you like to share? Would you like to share a brief insight into preventive care measures for COVID-19? So here what we'd like to say is preventive measures is mainly exposure should be prevented. So washing, wearing a mask and other measures which I told you earlier. But one thing what we can do is washing the area. So mainly nasal washes. Saline nasal washes will really help you in preventing a lot of cases of COVID-19. So what you have to do is take lukewarm drinking water, take about 200 ml, add a teaspoon of salt and use that to wash your nose. So you stoop over the wash basin and flush your nose with that. The water will come out from the other side and from the mouth you blow and clear it off. So this cleanses your whole system of the viral infection or the route of entry of the viruses. So along with the care of the food, excess of vitamin C and zinc and adequate rest, hand wash and mask, nasal wash will really help you prevent COVID-19. I think everybody should be doing that along with the goggles so that you cleanse your oral cavity too. And special advice to mothers who are the custodians of the family's health. I think that's one question which is asked here. I think these things which I was telling, if you bring into your day-to-day routine, that would be good, so that you see that everybody does these hand washing. Like in our old household thing, everybody used to follow certain cleanliness and certain things like washing hands, brushing our teeth, doing gargles every time you eat anything, having home cooked hot food. These help in building up the immunity. If a person has some infection, maybe you can take care. It's better to keep the person aloof so that it doesn't mix up with the rest of it till you see that the person recovers from it, unless you have other symptoms which really direct towards COVID. But home cooked food, adequate rest, hand washing and washing of the feet when you go out, avoiding crowding and wearing a mask always when you get out of the house should really help you prevent this pandemic or spread of this pandemic further. So there's nothing to panic as such, but we need to take certain precautions so that we don't get the infection. And it's not that only we don't get it, we don't become a carrier and take it to the family and give it to the elders or the people in the family who are more vulnerable, who can succumb to the disease or end up in major problems. So that's what is the message. Usually there are simple measures which we can do on a day-to-day basis which will really help us, like nasal washing, take care of your diet, hand washing, which will take us a long way and maybe to bring us to the downslope of the pandemic curve so that we recover from this faster. I think this addresses most of the questions asked or the queries what everybody has. Thanks a lot. Thank you so much for listening.